Alright, so for this video, I'm going to be doing the history and observation section of a knee evaluation. So first you want to start out by asking the athlete their previous history, if they have previous history of the condition in which you're looking for, and you want to ask them for a mechanism if you did not see it, or to look for the mechanism of injury. So what you can do while the athlete's lying down to observe, you can look at, you can do girth measurements, look at the tone, muscle tone, quadriceps, specifically VMO, and then you can have them flip over and we'll look at hamstrings. In the popliteal fossa you can observe for Baker's cyst as well. You can also look at the IT band insertion from the side. You can do this in prone or in supine. Alright, thanks. Flip over again. So we want to look at the patella. Look at, see if it has Baja or Alta. You can take measurements for that. The tibial tuberosity and tibial crest. You want to look at the fibula, fibular head. That's more palpation, but that's what you're looking. And you want to look at the tibiofemoral alignment. You compare this bilaterally. And you want to look for excessive recurvatum, so hyperextension of the knee while laying down. Yeah, that's good.
So now we'll be doing palpation of the knee. So first we can start with the soft tissue. You have the quads, so the rectus femoris all the way down to the knee, the vastus lateralis, vastus medius. You have the IT band that runs down like this. And then you have the soft tissue of the quad tendon here and the patellar tendon. And on the back you can have the hamstrings, the bicep femoris, and then semitendinosus and semimembranosus, and that runs up the back of the leg as well. For bony tissue, you have the femur, you have the adductor tubercle, pes anserine, Gerdy's tubercle, tibial tuberosity, tibia itself, fibular head, and the fibula itself, fibula. You've got the patella as well, and then you have patella bursa, so suprapatella, prepatella, infrapatella bursa, and then the pes anserine bursa. You also have the popliteal fossa in the back where there's arteries and nerves, so you can see if there's any blood flow or radicular symptoms in the back, and then also if there's a Baker's cyst you could also palpate that. You also have the joint line, so you can palpate the joint line, the lateral and medial joint line, and with that the ligaments, so the MCL here and the LCL on the other side. And then I'll turn over here. And palpate the tibial plateaus, and in there you have the menisci, so lateral and medial menisci. And I think that's it for palpation of the knee.
Now I'm going to do the manual and muscle test. So the first one I'm going to do is sartorius. So for this test, you apply pressure, and then can you hold this pressure? Alright, and then you compare it bilaterally, and she held the pressure, so it's a 5 out of 5. And then the next test is the knee extension test. And then so for this, you have them extended, and then you ask them to hold, and then you compare bilaterally. And then the final test is laying on your stomach. For this test, you're testing both types of hamstrings. So the first one, this is for the medial hamstring, so can you hold this position? And then for the lateral hamstrings. Alright. And you compare it bilaterally. Alright, the next test I'm going to do is the ACL test. So the first one you can do is an anterior door test. So for this, just pull it forward. And then if they have a positive test where the tibia comes out, it is possible ACL injury. And then the next test can also be done in this position as a PCL. So that's injury to the back ligament. and that's when the tibia goes backwards. And then the next one for another test for ACL is the Lockman's. Alright, and then that's a test for ACL also. And then another test for PCL is Godfrey 90. So I'm gonna put the patients in 90 degrees, and then you're looking at the tibia tuberosity and see if it sinks down, which hers doesn't, but if it does, it's a PCL injury. And then that is all of the ACL and PCL. The next test I'm going to do is varus and valgus. So for this test, for valgus, you're going to have them extended and you're going to push on the joint line. And then you're also going to bend them at like 25 degrees and then push on the joint line. And this is isolating the MCL. The other one, the extended full extension, is the capsule and the MCL. And then you can also, and then varus is in full extension. This is the LCL and the joint capsule. And then have them slightly. And then this is just for the LCL. And then, yeah. The next test I'm going to do is the silicone drawer test. So you're going to have the patient flexed, and then you're going to put their foot into internal rotation, and then you're going to pull out. And then this is testing the anterior lateral for anterior lateral instability, and then you move the foot into an external rotation, and then this is testing for anterior medial instability. This next test I'm going to do is McMurray's, and this is for a meniscus injury. So you apply pressure at the foot, and then you do. And then if they have any popping, clicking sensation inside of the knee, that could be a positive test of a meniscus tear. The next test is Apley's. So I'm going to apply pressure downward, and this is going to cause the patient pain, and then I'm going to distract, and then this is going to relieve the pain for a meniscus injury. This test is Apley's. So for compression, you're going to push down and you're going to rotate the foot, and then you're going to distract for it to relieve the pain. The next test is Thessaly's. So can you stand up for me? And so for this test, on the injured side, they're going to stand on it. Then they're going to hold on to me, and then they're going to twist side to side. And if they have any pain with that, they could have a meniscus tear. And then you're also going to flex a little more, and then rotate some more. And then if they have pain or clicking with that, it could be a positive meniscus tear. The next test we're going to do is a crossover test. So this is for instability of the capsules. So I'm going to have the patient stand on the injured side, and then you're going to bring your foot across, and the front is testing for lateral instability of the capsule, and then can you bring your foot behind, and the back is testing for medial instability of the capsule. The next test I'm going to do is external rotation reculovatum. So you grab the feet of the patient, and then you see if they hyperextend, which could be a posterior lateral corner injury. And then the next test I'm going to do is a dial test. So can you flip over for me? So for this test, you have the patient lying there, and then you have them about 30 degrees, and so then you twist out their feet, and you look for excessive external rotation. And then this is for posterior lateral corner, and then you put them at 9 degrees, and then you externally rotate, and this test is for PCL. The next test that I'm going to be doing is the plica test. So the first one, you're going to put them at 90 degrees and then internal rotation, and you're going to palpate the medial side, and then you're going to move them, and you're feeling for any clicking or discomfort. And if they have clicking, then they have a plica. And then the next test is the stutter test. So can you short sit right here for me? And so for this test, you put turn your foot in and then extend your leg. And you're looking for any pauses because of the clickings going to stop them from the motion, and if that means that they have a positive test of a plica. The next test I'm going to do is Wilson for OCD. So this, you're going to ask patients to turn their feet in and then extend the knee. And if they have pain with that, they can relax and then point your feet out and then extend. So that's going to relieve the pain. And if they have pain with internal rotation, they could have a positive OCD. The next test I'm going to do is Noble's test, so can you lay down for me? And this test is for IT band. So you're going to compress and then you're going to move into flexion and extension. If they have pain with this, then they have a positive for IT band syndrome.